Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I'm going to go over the top 6 reasons for claim denials. Claim denials is something that needs to be followed closely in your practice, and it definitely needs to be examined, analyzed further to identify areas that are causing the claim denials so that if there's anything that can be fixed upstream to prevent further denials, then it needs to happen. And it's one of those things that can affect your finances. It can affect your patient interaction, your patient perception of your business and your professionalism. And it also can affect your staff and how many people you need to work on your billing versus if you were to fix things and prevent these denials. So, I mean, the denials of claims affects all different parts of your practice, including patients. Because if you're getting denials and you're having to keep resubmitting and you finally get it to process, it could be months from that patient's date of service. And let's say there's a patient responsibility or cost share on that claim. So deductible, co-insurance, whatever it might be. And they're not getting a bill for 3, 4, 5, 6 months after they were seen because of your inability to send out clean claims and correct them quickly if there is a denial, then that doesn't look good to patients, right? And then it's taking more of your staff time to do it, and it just can be a nightmare and it can snowball really quickly. So these are going to be the top 6 claim denial reasons. Now, this data came from a health IT firm, and they surveyed 200 different people in practices who are directly working on claims. And usually it was at a managerial level, some kind of high administrative level, that answered these questions about the claims in their office. So when I give you the percentage, it's the percentage of how many times the reason I give you was their number one reason for claim denials. So then what they did is they took the number one reason for claim denials and they tallied each time it was number one, and then they compared it to the total amount, and then they ranked them. So I'm going to give you the top 6 percentage, but I will have the link to the article in the video description if you want to see all 13 of the top claim denials and also read more about it, because we're just going to do a high level overview. I'm not going to go over how to prevent it. I'm not going to go over on exactly, how to fix it, but I am definitely going to just tell you what they are. And if you can relate to this, then most likely there is something you can do upstream to prevent it from happening over and over. And of course, you're always going to have claim denials, but if you can get those to be very, very low, the more successful you're going to be and the faster you will get funds and have a healthier financial portfolio in your business, okay? So the number one reason for claim denials, with 48% of the people interviewed saying this was their number one reason, was missing of authorizations. Okay, and when we're saying claim denials, again, let me go back. It could just be like 1 or 2 line items denied on a claim. It might not be the whole claim with all the CPT codes, but it was a reason to have to rework the claim and delay of payment for all the services rendered. So we're going to put that all together, okay? So there is a possibility that this authorization could have been for the entire visit and all the services, or possibly it was because there was 1 or 2 services on there that required a prior authorization, but maybe the E&M office visit code didn't require it. So they paid that, but they didn't pay for the ancillary services, okay? But 48%, that's almost half of the people interviewed, said their number one reason for claim denials was authorizations. And that is definitely able to be fixed upstream to prevent further downstream, okay? Number 2, 42% of people said it was due to code inaccuracies. This comes down to why I believe every office should have an experienced coding professional, someone who has experience in your specific specialty in the field, 5 to 7 years experience. They're very competent. They're very well versed. They stay up on all the coding changes. And even if you have a billing company that does your billing, they might not do your coding, or they might not do your coding well enough. And so having somebody internally to really make sure that your providers are educated, they're scrubbing those charts to make sure you're not leaving any money on the table, you're not overbilling, that you have the proper information that you need for the services rendered, that they're using the right CPT codes. So important, okay? Another thing that is easily preventable in bulk, okay? Number 3, 42% again, provider eligibility. Making sure that the provider is participating, that they are in network, that they are able to bill the CPT codes by their taxonomy and get reimbursement. To make sure that you are seeing patients who have out-of-network benefits, so that if your provider is not contracted, you can still get paid. 42% for something that is very, very avoidable. And I have a ton of videos to go over credentialing and contracting and making sure that you're only seeing patients in the plans of the payers that you are contracted. There's really no excuse. It happens. There's things that get by, or you're like, oh, I didn't know about that plan, but it should only happen once. It shouldn't happen over and over. Use of incorrect modifiers, or maybe missing modifiers. I don't know. It just says incorrect modifiers. So are you putting a 59 where there should have been a 72? Are you missing a 25 where there should be? Are you maybe not using 59 where you should be? I'm not a professional coder. I don't know a lot about modifiers, but I do know I have seen my fair share of claims getting denied because of modifier issues. And it's really sad because, again, this is where a professional coder can help you so much. Out of the top 4 so far, 2 of these are related to having somebody in your office that knows what they're doing when it comes to coding the claims correctly. Okay, yes, it's a little bit money up front, but your return on investment of hiring someone who is skilled, experienced, knowledgeable is literally going to pay off if you're not having to get denied claims, rework them, play the guessing game. I don't know what's going on. I don't know how to fix this. And let's try this. This gets denied again. Okay, let's try this. I mean, that's terrible, right? So put the money up front, get someone who can help you. They can wear multiple hats, right? They could also maybe be your contact internally for patients calling with questions. They could work on your internal collections workflow. They could help the front office with eligibility questions. Usually they're very well versed in billing in general, and their focus is coding. So it doesn't mean they can't wear other hats, especially in a small office. Number 5, failure to meet submission guidelines. This comes down to usually providers not completing their chart notes on time so that claims can be submitted. You gotta keep on top of these providers. They get busy, they hate the administrative side of things, and they neglect completing their chart notes. If chart notes are not completed and signed off, you cannot, by billing compliance, technically send a claim. They have to be completed. There's multiple reasons for this: patient safety, billing compliance, etc. But you need to have somebody staying on top of these providers to make sure that they're getting them done. You should have certain clauses in their contracts, their employment contracts, stating how soon they're expected to complete chart notes after they see a patient, and having some kind of repercussions if they don't. I know practices that take money away from providers for it, or they make them pay a penalty. There are certain things that you can do. You have to follow your laws and regulations, so I would consult an attorney before you put those in there. But definitely have some kind of repercussions, because usually it's due to providers not completing their chart notes, or they complete them so late that by the time it gets to the coder and the billing staff to be able to do what they need to do with the claims, it's almost too late, or it gets to be too late, right? They're cutting it way too close. And different payers have different guidelines, right? We have not 30, we have, I think the closest I know is 90 days, or 60 days, 90 days, 120, and then we have 1 year. But you have to check your payers. Everybody is different, right? So you need to be staying on top of that. You need to understand what your timely filing limits are, your appeals filing limits, right? Maybe something got denied and you want to appeal it and you drag your feet. Or maybe you have staff that are supposed to be scrubbing and doing certain things on rejected claims from the clearinghouse, and they're so bogged down, or they've been out of the office, they're not able to get to them in time, and you're finding things aren't being able to be submitted by the deadline. So you have to figure out if that's causing claim denials at your end because of timely filing. Who is responsible? Is it because of the provider? Is it because of your staff? Is it because you have inefficiencies that you need to put better workflows? There could be multiple things, okay? And the last thing, number 6, is patient information inaccuracies. Again, something that's so easy to avoid if you train your front office staff properly. This means that a patient's name was entered incorrectly. You're maybe missing the middle initial. Date of birth is entered incorrectly. The subscriber ID is incorrect. They're still registered under an old insurance and they have new insurance. Maybe there's so many things that could go on with patient inaccurate information, but this is very avoidable as well. And there should be other checkpoints in place, especially with all of the technology and automations that we have. EMRs should be able to assist you with this. And then just having that proper training with your front office expectations and holding accountable. If you're getting a lot of claim denials, identify the trends. Is it all one provider? Is it all one person not checking eligibility? Is it all because you don't have a coder? There are things you can identify to figure out what is the root cause so that you can try to prevent those claim denials in the future. All 6 of these, and I promise you all 13 from reading the complete article, are avoidable in bulk. Again, things happen. You will have claim denials. It's just inevitable. But if you're getting a ton of denials for the same reason, something needs to change. So who's responsible for that in your practice? Who's going to be holding people accountable? Who's going to fix workflows and efficiencies? Who's going to identify these trends, right? Claim denials is delay in payment. It's money out of your pocket. And it's very, very detrimental to a practice, especially a small practice that's just up and running, or one that's very infancy or during deductible season where money and funds are tight. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your colleagues whom you feel would benefit from the information. We'll see you next time. Thank you so much. Bye-bye.